In Health Watch, tardive dyskinesia, or TD, is a relatively rare condition that impacts around 500,000 Americans. The neurological disorder is typically caused by long-term use of certain medications and can cause uncontrollable jerky or repetitive movements. Earlier this year, we spoke with Dr. Neeta Ogden about TD, starting with what it is.
So tardive dyskinesia is a very serious side effect from these medications that are used to treat schizophrenia, bipolar disorder. The medications are called neuroleptics or antipsychotics. And it is a very significant side effect because it leads to involuntary, automatic, jerky movements of the mouth, the face, the eyes, arms, limbs can be affected. And what does that look like? Excessive blinking, sticking out your tongue, lip smacking, flapping your arms, tapping your feet, just to name a few.
So do people need to be prescribed these medications which can cause TD, or is it that if you prescribe them something different that treats the condition that they have, they won't be afflicted with TD?
Well, ultimately what it is that if you're given certain medications, these neuroleptics, one of the possible, yes, rare side effects can be TD. And the neuroleptics have their first generation, which are older, and the second generation, the newer ones, have less incidence of TD, fortunately. There are medications that can be used actually once this is detected to treat TD as well. Unfortunately, sometimes the symptoms can persist even once these neuroleptics are stopped. So that's another important thing to keep in mind, that if you do develop these symptoms, you must go see your doctor. Actually, the doctor who is prescribing these medicines should be doing a monthly assessment, basically a scale where they are looking at your involuntary movements every month so that they can be on top of the diagnosis if the symptoms are setting in. And always see your doctor first. You don't want to stop these medications cold turkey ever. Your doctor can lower the dose, possibly change the medication, find different options for you.
I imagine an unintended consequence of this side effect is that people just go off their medication. And you listed some pretty, concerning mental health illnesses.
Yes, and I think that this is why I think it's so important to have an awareness week, because these kinds of mental illnesses are already so isolating, and when you develop these kinds of debilitating side effects that draw attention to you, it can be even worse. So it's important to have it on our radar and our monitor, and so many doctors are often involved in the patient care that not all of them may be aware that this may be what's going on.
So what are some of the ways that people with TD can manage it?
So one of the biggest things is to be on top of your doctor's appointments, and somebody with schizophrenia or bipolar disorder may not necessarily always have, they have to have a good infrastructure if they need it, somebody who's helping them, a family member, or some kind of organization that makes sure that appointments are not missed. And also know about the risk factors. It's more common in menopausal women, in people with a history of alcohol abuse, Asian Americans, African Americans, and people over the age of 55.
Sounds like everybody.
Certainly a lot of people.
A lot of people,
yeah.
but only 500,000 people in the country are afflicted with it.
Right, only 500,000 people. And in terms of percentages, if you're taking a first-generation neuroleptic, the incidence is about 6%. That drops to about 2% with the more the new second-generation.
So there are options out there.
Yeah,
Dr. Ogden, thank you so much.
Thank you for having me.